Got it.
Hi, Katie. Thanks for meeting with me today. My name's Laci, and I'm one of the SLPs working on your mother's case. As you already know, your mother has suffered from a stroke in her left temporal lobe. That's this side of the brain. From what we have discovered from imaging, it looks like the damage occurred between the places called Broca's and Wernicke's area. These are areas of the brain that are responsible for people's speech production and perception. From what I have seen from examining your mother, my team and I have diagnosed her with something called transcortical motor aphasia. Aphasia is a disorder that affects how you communicate and is common in people who have had a stroke. Transcortical motor aphasia is classified as non-fluent, meaning that speech is halting and has lots of starts and stops. You've probably already noticed this when you've been speaking with your mother. Your mother's stroke has affected the neural pathways that are responsible for motor speech, meaning she is having trouble getting her mouth to produce the words that she is wanting to say. During my evaluation with her, I noticed that she had something called paraphasia. This is something that is common with people with aphasia and is affecting the words that your mother is producing. So when you are speaking with your mother, you might notice her substituting words or making up words. For an example of this, I noticed when I evaluated your mother that she used the word house instead of school, and she said octopuctus instead of octopus. It is important to remember that this is common for people who have suffered from this type of stroke, and that you and your mother have to know that this is something we're going to work on in treatment. Another thing that I noticed during our evaluation is that your mother's perception and comprehension of speech are still intact, meaning that she can understand what you and your family members are saying to her. So it is important that you continue to talk to her like you normally would and know that she can understand what you are saying. Another positive that I noticed during our evaluation is that your mother's repetition skills are still intact, meaning that she is capable of repeating single words and short sentences. I administered the Boston naming test to your mother during our assessment, and she did really great with all of the tasks I asked her to do. This will be a focus point for treatment as we help her with her spontaneous speech. My team and I have decided to work with her 1 hour a day, 5 days out of the week for a 5 to 6 week duration while your mother is still here in our facility. Our focus is to help improve her spontaneous speech. After your mother is discharged from our facility, we will refer her to our outpatient clinic where she can continue seeking treatment. Additionally, we are also planning to hold weekly family sessions where we can teach both you and your family and your mother on techniques that will allow for optimal communication. I'll send you more information on that as soon as possible. I know this is probably scary and a difficult time for you and your family, but I want you to know that we are here for you. I've printed out a copy of the things we have talked about today, and I have also included some family support group and resource information that I encourage you and your family to take a look at. It's important that you and your family also take care of yourselves in this difficult time so you can be prepared to take care of your mother. I know this was a lot of information thrown at you in a short amount of time. If you have any questions, please don't hesitate to reach out to me or anyone on our team. We would be glad to schedule another meeting and go over any concerns that you might be having. This is going to be a long process, and I'm sure we'll be coming a lot closer in the weeks to come. Thanks again for meeting with me today. I'll be sending you the information on weekly family sessions soon. If you have any questions or concerns, please don't hesitate to reach out. Thanks.
Thank you.
Hi, Laci. My name is Katie, and I am one of the SLPs working on your dad's case. Since he had a stroke and he's come in to see us, we've been working with an SLP team, and I just wanted to talk to you today about the type of aphasia that he's experiencing. So aphasia is a communication disorder that impacts someone's ability to speak, read, and write, but it does not impact their ability to think or any of their intellectual abilities, but just the way that they are communicating. So since your dad experienced a stroke, there was an area of his brain that was affected by the lack of blood flow, and so that area of tissue is not able to do its job as well as it did before. So your dad's aphasia may allow for some word gain over time, and with speech therapy, it's possible that he will be able to get a little bit better at some of these communication aspects. But I want to talk to you about what his communication is going to be like now. Aphasia affects everyone a little bit differently, but there are some characteristics that are going to be consistent with the type of aphasia that your dad has. The type of aphasia that he has is called Wernicke's aphasia, which is caused by damage to the left middle side of the brain, which is where there's an area for language processing that's called Wernicke's area. So this is what must have been injured when your dad had his stroke. This means that his ability to understand spoken words and sentences is affected because his language processing centers have been impaired. Another piece that is affected will be the content of what he communicates. So people with this type of aphasia have the ability to speak in grammatically correct sentences with a normal rate and prosody, but they will often use irrelevant words or made up words in the sentences that they produce. So this will be shown in the form of them using a typical sentence, but swapping out the content words for words that are random or are related, but just not what they're trying to say, which you probably already noticed talking to your dad. This could sound like if you were to ask him how he got here today, he might say, I got here in my wagon, instead of saying, I got here in my car. Or it could also sound like, I got here in my flip-flop, or I got here in my big wheel. It is possible that there could be more of the sentence that is communicated as nonsense words or out of context jargon, but it could also be that there are some whole sentences that you or he does not understand. It's important to be patient and to think of some other ways to aid communication so you're not only stuck using spoken words that he gets stuck on. Oftentimes, when they use language like this that does not make sense or at all or in this context, they won't realize it, and he will continue speaking as if the previous sentence made total sense. And something that has been shown to be helpful with other Wernicke's aphasia patients is the use of gestures and body language or some other context clues that can help him communicate the words that you want to tell him, but also for the words that he wants to tell you. So people with this aphasia can have intact reading and writing skills, or they can also have been affected. We will be using some tools to determine what your dad's skill levels are in this area, and we can use these to work on our communication with him to maximize your communicative ability. There are some forms of testing that we can conduct to see how your dad's abilities are in each of these areas. And with the results, we'll be able to figure out what the best type of treatment is that we can provide so he has the best communication possible. But for now, I think he has a good prognosis given that his family has been very supportive and he seems to have a great attitude about it. So I just wanted to thank you for meeting with me. And if there's any questions or things you want to talk about, I'm always available to chat. And I'll be sending you some information about what we talked to today, just so you don't forget any of it. So thank you.
Yeah, thank you.